All right, welcome to a Wintery note about contacting WPS policy staff. This is about contacting the policy area within WPS versus contacting customer service. If you contact the wrong area, it actually creates inefficiencies for you and takes more time. And we really don't want you to do that. Let's do that. Time is money, and therefore let's get to the right place in the first time. Okay? My name is Tom Ryan, and I'll be your educator today. I'm with Provider Outreach Education. Today, I'm joined by a lot of members on my team. I've asked Mary Sue to give me a hand. She can put some stuff in the chat for you, so keep watching that in case you need anything. She may also field some questions along with any of the other members from my team. If you would like to download this presentation, please go to our live events page. It's on our website. You can download it there. Once this presentation is done, we will then move it to the encore presentations. So you heard me say I was going to do a recording. That's what the recording's used for. We're going to record it. We'll post it into encores. We'll get it there for you. Want to remind you that there is more disclaimers at the end of your slide deck. So you can take a look at the last slide if you're interested. What is our goal today? Well, the goal today is to get through the understanding of when you should contact the policy department at WPS, which these are the staff that work with local coverage determinations and local coverage articles, LCDs and LCAs. So we want to talk a little bit about that. We want to make sure that you're getting to the right department because they don't handle certain portions when it comes to processing claims underneath those. They're the preemptive ones, the ones that help set up the edits and the audits and all those fun things that actually go into place. So we want to make sure that you understand when to contact them. Now, in order to do that, I do have to explain the 3 times that you really will contact them. 1, when you are requesting a new LCD. 2, when you're submitting comments on a draft LCD. And the 3rd time is using the LCD reconsideration process. So we're going to go through each one of these. Before we get too far into this process though, we did get some general questions like, what is an LCD? An LCD is a local coverage determination. And can you help me understand the process? So I decided to build in the building blocks, the backbone of this presentation. This is hopefully to answer all of those questions you had that were really basic, and I just gave you a couple of them. Okay, so want to remind you, if you want to contact LCD, you have to understand, or I'm sorry, if you want to contact policy, you have to first understand that they work with local coverage determinations, LCDs. Their job is to write them based on evidence. They can write them for us, WPS, in our jurisdictions, J5 and J8, which is Iowa, Kansas, Missouri, Nebraska. And we do have some national providers that have home offices in those states, but they're actually across all 50 states. We also have Indiana and Michigan providers, okay? The LCDs do need to use a peer-reviewed evidence to determine if a service is covered or if it meets certain procedures. And then this falls under the Social Security Act, and there's a lot of information about it. But if you want to look at the basics of it, it's the medical necessity area. One interesting step is someone did say, could you write an LCD as a non-coverage LCD? And the answer is yes, we can do that. You know, new technology not supported, that evidence isn't there to support the medical necessity for it. We could actually write an LCD to say, we're not going to pay for this yet. And then we'll go through the steps later where you could actually get that looked at, okay? I'm going to go really high level through the process. And when I say really high level, I'm going to give you the steps, but there's a lot of detail that go within these. But step number 1 for a local coverage determination, the first building block, is an optional step that a provider can take or that an interested party can take, and that is an informal meeting. Step number 2 is the formal written request. Step number 3 is our policy staff will review for validity of the request. Step number 4, our staff will respond. Step number 5, the staff does the research. They have to look at the literature, they look at the claims data, they do a lot of research and put this together. Step number 6, based on the research, they can choose to draft an LCD and an article. Now remember, a local coverage determination is the medical policy. The local coverage article contains information to support the policy, the LCD, and the article is more about the edits, the audits, the procedure codes, maybe some modifier information. So it's different than the medical necessity portion. The LCD is medical necessity, the article is the coding and billing. Now, once they've written it and it's a new policy, it's going to go into the public draft period. Now, the public comment period. This is a draft period, and it's one of the times when you can contact them. What does this period do? It allows anyone that's interested to give feedback. This could be someone like a beneficiary, could be any medical doctor, maybe a non-physician practitioner, can even be a manufacturer if their stuff is affected. Okay. Then once we close that comment period, we then move into consideration of the comments. And what they have to do is go through each comment and draft whether or not they're going to take it and get a document ready for that. They also changed the draft. Well, that makes sense. That's what all the comments were about. The next step is to publish the final. Did y'all catch that? Publish the final. It's not to activate it yet. And we want to make this clear. It must be published for at least 45 days. Once that 45 days passes, we can then make it active. So we're going to notify you. So it is some different times that you'll be able to contact them, including asking them to look at one that is final right now, but maybe there's some new evidence out there, so we need to change it. So we'll talk about all these different things. Here are some things that just are frequently referred to. One, when it comes to contacting the policy department, and that's policy comments at WPSIC.com, please don't ask claims denial related questions. Those must go through customer service. Now, customer service's job is to look at a claim, not a policy, to determine whether or not that policy should have applied. Is there an issue with an edit or an audit that was written? They can work with our policy department staff, but that really is customer service. So first thing I want you to write down, claims equals customer service. If you disagree with the claim determination, then you must go to an appeal. If you don't understand the claim determination, that's customer service. So I don't like what you did, okay, or I do feel this is medically necessary. That is an appeal. One thing that came up and one of the questions that was asked is, could I write for a claim appeal and a policy appeal? Well, policy appeal is actually called a reconsideration, and absolutely you can do both. You may have to, so we'll explain a little bit more on that. Also, if you're just looking for general information on an LCD, that's what customer service does. They just can explain in general what it is. Really, when you're looking at contacting our policy department, remember that it is the interested parties, and I'm going to define those next. And their job is to really look at existing policies, new policies, etc., and to write those and to respond to those. Their job is not necessarily to talk about the claims. Once that happens, that's after the fact, and that would go through customer service. All right. I had a couple of different questions come in about interested parties. This is available information on our website, but it's who can request a WPS policy. And the key things to remember is it's people that are affected within our jurisdiction, which means that yes, a patient or a beneficiary residing or receiving care in our jurisdiction can request this. It's not uncommon to get that. Providers doing business in a contractor's jurisdiction can. The last one is the one that people get a little bit confused on, and they're like, well, what is an interested party? And if you think about it, think about a um, medical process manufacturer, or they do new technologies. Maybe they look at how things are done and the way that they are done differently. That person, that manufacturer, that technology person does have the right to ask us to write a local coverage determination covering their information, and then they have to give us a bunch of stuff to support it. So that would be an interested party. So hopefully those all make sense. And any of those could qualify or fall underneath that interested party. Some of what we get are questions coming into the policy department, but they're not from someone valid or it's not an interested party. That's not going to help. One of the other things is to remember that if you have a patient asking questions about a policy, that patient must go to 1-800-Medicare. If 1-800 Medicare needs additional support, they will contact the Medicare administrative contractor who wrote the policy. So patients do not contact either our policy department unless they're requesting a new one or unless there's a variety of other reasons. For the most part, though, just general explanations, they're going to go to 1-800-Medicare. Policy contacts, and I know I had Mary Sue put this in the in the chat already. It's also going to be right on here. The preferred contact is actually through email. And that email again is policy comments, all one word, at WPSIC.com. You can fax information and you can mail information. But again, the best way to do that is with a email. Now we'll talk about some of the advantages and disadvantages and things like that. Okay. That's the basics that I have. Oops, sorry. So now we're going to move into the new LCD request. And before I do this, I want to show you a page on the website that will help you. So if you get confused and you're looking at this, I know a lot of people don't do these on a regular basis, and I think sometimes that's what causes the confusion. So let's go ahead and go to the WPS website. We're going to talk about new LCD requests. First, the WPS website is WPSGHA.com. From there, staying up next to the logo and go to the next item over on your screen, and that's going to be topic centers, and there you'll go to policies. Okay. This is on the far right side, last item. Open that up and you can scroll down and you can see a variety of different pieces of information. Okay. What's great about the process is it's the same regardless of what jurisdiction you're in. So those processes are the same. So if you want to know a reconsideration, termination, what are we looking for? You can do that. If you don't want to do that and you just want to come down, you can go local coverage. And then underneath there, you'll see new local coverage requests. And this will walk you step by step through and tell you where the information comes from and what you need to do. Okay. So it's on the website, it's publicly available. Now I'm going to walk you through it again just to make it a little easier. I made some slides kind of to help us out. So the first thing they talk about is the informal meeting. Remember, I mentioned this is not a mandated section when requesting a new policy. It is something you can do. I'm going to tell you from our perspective, from the provider outreach education, from the policy perspective, please do this. It can only benefit you. The purpose of the informal meeting is to have our policy staff look at the material that you have. Are you going to get this even considered? We're not saying you're going to get a policy written, but do you have the proper evidence? Do you need more? What is everything put together? So it really is an educational meeting. It is not a meeting to say, oh, we're going to absolutely give you. Okay, nope. When we say discuss the evidence, it's do we have enough evidence? What evidence would we really be looking at? Is it not peer reviewed? What's going on with all of the different things you're giving us? It also is a great meeting to help you get that formal request, which would be the next step, done correctly. We will dismiss a policy request, an LCD, local coverage determination request, if it's not written correctly. And so if you want to avoid that, this informal meeting, which is really easy to, you just put it in an email, I want an informal meeting, they'll help you through it. Okay. Again, the best thing to do is to contact via email and just say informal meeting request, explain a little bit about that. A couple people asked if they could incorporate or send different information with this. Yes, you can. We recommend that you PDF anything that you're sending. Hopefully you can get a little bit more in it, or you can also zip, compress those files. Those are great ways to do it. Things that we're unable to do. If you give us a website, unfortunately, due to security criteria, we can't just go out to the website. We can't just open it up and there it is. So you have to make sure you can pull the information, put it into a PDF for us. Now, again, that's just how an informal meeting works. Okay. Once an informal meeting is requested, we'll go through it. We'll meet with you. Not we, the policy staff will meet with you. They're going to consider your request. What they're looking for is, do I need additional information? Should this go through as a new request? What else is going to happen with it? And then they're going to let you know. Hey, nope, this one's not likely to go through. We don't have enough supported evidence. Or this one looks good. We can't guarantee we're going to do a policy, but this one looks good. You can get all the information. You have everything you need. Go ahead and send in a formal request. Really, that's the goal. For you as the person requesting it or for an interested party, the next step is to actually do a formal written request. Now, someone asked me, why does it have to be in writing? And my answer to you is because CMS requires it to come in writing so that we can gather the evidence and the language, the information that you want to make sure we're meeting your needs. That's the ultimate goal with policy, and that's why this doesn't come through customer service. Having that extra step can actually make things a little bit different. So here's what you're going to do. You're going to make sure that you get all of the supporting documentation. Once again, please make sure not to link to it. If you send us a link, we can't open it. You could send us PDFs. You could send us, again, the zip files, any of that. Okay? Inside this, it'll walk you through everything that has to be there for the new request. So I thought, well, let's just keep going and put some of the required information that you need on the next slide. So one, it does have to be written, and the thing is that it has to clearly identify the statutorily defined Medicare benefit category along with the language you want in the LCD. Now, does a request guarantee that that's the exact language we're going to use? No, but it does give us a starting point in what you're looking for. You must also then justify the LCD. You can look at any kind of evidence or information that's on relevance, usefulness, clinical health outcomes, or medical benefits. Remember, this is some of that proven stuff that we're looking for. It's a study that says, yes, we did this, this, and this, and then, oh, here's another one that supports it, or here's a peer-reviewed data on it. Again, all of those different types of pieces of information. You really do want to explain the design, the purpose, the method. You can choose one or all three. It just depends on what you're doing with it. But you really want to give us as much information as you can. What that will do is help us when we look a little bit further into it. Because just because you send us a request doesn't mean we're going to write a policy. On the other hand, it does mean that one of our medical review staff, who are WPS registered nurses and contract medical directors, RNs and CMDs, they'll give you a notice. Yep, we took it, we didn't, what happened, the information was great, we're good. Okay, now we're going to add it to our backlog. Now our backlog is simply just a big log that says, here's a bunch of policies to consider, but they can't just consider them alone. In order to make a new LCD, you'll then have to move it to the draft LCDs process, which comes next. So we do a variety of different pieces of information. Once it's on the backlog, you can see it says added to a list for data research and possible development. That is the next step, which then begins another step, which is the draft process. Okay, so in order to draft an LCD, we can consider everything you sent, but not just what you're sending in. We have to go back to our data. And do we need this? We have to go back to data proven by medical practices. We have to go back to data looking at the different areas and is it needed within our area? And there's a lot of data to compare. So that's where the next step is, okay? And this is all done by someone that's in the policy staff. I do want to let you know that if they choose to write a draft LCD, and we'll talk about the comments that come in with it in just a few moments, this is the best step to make comments. This is the best step to let them know whether you agree, disagree, you have more evidence, whatever the situation is, before having to do a full reconsideration of a final. I think this is the best step, okay? Let's keep going on with draft LCDs. So first, a draft LCD is proposed and put together. What happens is a policy staff, again, does all this research. They will write the best language that they believe fits into it. Okay. Once that draft LCD is proposed and put together, we then will put it on our website. Now, I want to remind you that along with a local coverage determination or an LCD, they may also write an LCA or a local coverage article. What was that article again? That was the coding and billing stuff. That was your procedure codes. That was your diagnosis codes, your modifiers. What kind of system edits are we looking at? That's what you're looking for there. Um, and so what happens is we'll put this available on our website, but we'll link to it on our website. It will be stored in the Medicare coverage database, which is available on the CMS website. So let me just show you where that is, how the easiest way to get there is. So we know that we went to the topic center. Next, we went to policies. Okay. And then if you look, it says proposed draft. It's like right here. And you can read down. Now, this is everything we're going to go through, and I think it's great information. And then you can go and you can say, okay, here's some policy comments, but I don't see anything. Well, it tells you, go to the Center for Medicare and Medicaid Services website in the Medicare coverage database. Very nicely, they give you a nice list for it. By selecting the list, not sure what. Mary Sue, can you verify that that came through without a bunch of lines in it?
Hi, Tom. Yeah, the MCD report page is visible on my end.
Okay, thank you. So I have some lines on mine, so I'm going to try to show it to you as best I can. But if I miss something, please bear with me. So what you're going to do is you're going to look for the Medicare coverage database, and this is just a search criteria page, and you can select any of the reports. What we're talking about is local coverage determinations, so you can come out and do final or proposed. I'm just going to do local coverage determinations. I think I'm picking by contractor. Yep, I did. And I'm going to say WPS. Now within WPS, we have a variety of states. So Iowa, Kansas, Missouri, Nebraska. Then we go national. We scroll down and we say Indiana, Michigan, and you can see the O2 equals B. So remember we talked about that on the website. So same thing here. We'll just let's just go ahead and drop into Iowa Part A, and it will come through and it's going to say, here are all of your draft policies, because that's what we asked for. Now, again, we can search this, make this bigger or more out, and you can actually read it. Okay, here's the draft. Here was when the final, was it issued? Yes, this one's in notice period. This one is in comments end. And so you can go through and it'll tell you exactly what's going on. Hopefully that makes sense to everyone. And you can read through all the different drafts. Now remember, one of the things we said is what happens, it gets posted for 45 days. So it's still in draft, it gets posted for 45 days and then becomes active. And that's what all these different little things are telling you. So here's the draft. Here's the final number that goes with it. Here's the notice period, comment period, all the different things that happen with this one. All within the Medicare coverage database. So if you're looking for this, it's a great opportunity to see that way to get to the drafts. We'll jump back to the PowerPoint real quick. So what'll happen is along with those, they will also put together, and they being our policy department, will put together a response. Every comment that comes in, and we take comments in a variety of methods. The first one is what's called an open meeting. Way to comment. You can attend this meeting and give us feedback. 2, email. Always the best way. Sorry, hands down, the best way. Send your comments in email. You've heard me give the email, policycomments@wpsic.com. Please put them in there. You know, even sometimes someone will go to like an open meeting and give a comment, and then the staff at the policy department will ask you to put that into an email. Why are they doing that? Well, especially if there's supporting information, they need the supporting information. They need to see it. So that's why it's always best just to send an email. I'm not saying don't attend or don't give other ones. Another way, which is a comment, is for a um, contractor advisory committee member to give us feedback on it. So the contractor advisory committee, it is a group of physicians, it is a group of specialties and providers and all of those. Uh, their job is to review this information. So it's really just an advisory group, and they will give us all kinds of comments. They could actually be an expert. Oops, sorry. They could actually be an expert and give us comments based on that too. So lots of different things come in. So then what the WPS staff gets the lucky job of doing is sorting through the comments and responding to everyone and deciding if changes are needed in the LCD. LCD. Now, I want to remind you that when you take comments after the comment period closes, how long do we have to incorporate or make changes to the LCD? There's no set time frame. CMS doesn't do that because they are also aware that some policies are a bit more controversial or have more comments, while others have very few. So some take a very limited amount of time. Just you're done and moving on. Others take a very long time to get through the comments. It really just depends because of the requirement of writing a response to all of them, making sure everything's incorporated. All right. So you've gotten your comments, and you've gotten your comments also on the articles. So they're going to publish an article. You'll please put comments like typos. Those are always great. And we want to look at those types of things and make sure we get all of that information. Okay. So what should we include? Well, as you get ready, please make sure that your comments explain why you want what you want. So whether it's a change, whether it's a verbiage change, whether it's simply a typo. Hey, I don't think this is the right procedure. If you put that procedure in there, you're telling us that we're doing a surgery for an x-ray. Okay, it's just a typo. Is there peer-reviewed evidence? Again, don't put a link in there. Give us the peer-reviewed evidence. We don't see where you've considered the following studies. Here's the studies. Is there FDA approval information that we need to consider that maybe wasn't done, or has it changed since the draft was written? I was surprised the number of times that happens. Also, your name and contact information. I can tell you if you email us and we just have this random email, and we'll take the email, but we don't know your name or contact information, we will not consider the comments. We need a bit more information to help us out with that. Also, some people like to say, hey, you're missing this information, and explain why you feel it's better for it, and then give supporting documentation to help us understand why that information is key, critical, or a part of this policy. So there's a bunch of different stuff you want to do with it, but it's not about the claim yet. It's still way back up in that draft policy. Okay. Now, again, all those comments come in, everything comes in, the staff writes all these written responses, they make all the necessary changes. That makes sense, right? Got a response document, I've made all my changes. Now they're going to post it in the Medicare coverage determination, or MCD, or Medicare coverage database, Medicare coverage database, and they're going to post a final. Now, yes, it's final, but it's not active. Remember, 45 days. And they're going to say, hey, here's the final and here's the active, and we saw that. And so you can go back to that exact Medicare coverage determination that we were just on. And if you go back, you can say, oh, okay, well, I don't really know what I want to do here. You can always go back to the search feature or the beginning. It just depends on how you want to get there. And I know I'm kind of making this a lot shorter. There's a lot of other features you can use on here, but you can do a search word. I'm just going to do allergy. Hopefully I spelled it right. And then, okay, that's great. I don't necessarily want a draft though. And I want everything for allergy related to the state of, let's just pick Iowa. That's in the WPS jurisdiction. And I can hit search, and then I can come out and be like, oh, look, here's an NCD, here's an LCD. National Coverage Determination written by CMS is an NCD, National Coverage Determination. Here is a LCD, Local Coverage Determination written by WPS. Oh, wait a minute, here's an article. LCA, Local Coverage Article. Remember what the article was? Coding and billing. So it's all here for you. You just got to narrow down, kind of move around with what you want and see where you're going with it. Here's the response document. So this is what every comment that came in, and you can open up and read all of those documents. Okay, so they're all in here. It's just, what are you looking for? Okay. And jump back to the PowerPoint for a second. And then remember, after 45 days, we'll turn all of our edits on. Now, if it is a little bit longer than 45 days, we're going to tell you that too. For the most part, we try to hold to 45 days. All right, so now we've got this active policy. This is where you can do a couple of different things. Ask us to look at it again and to reconsider the information within it, or contact customer service related to questions about the policy related to claims processing denials based on this policy, any of those kinds of things. They all go through customer service. So hopefully I'm emphasizing that enough. So the reconsideration process is only good once a policy is A, final, and B, active. So that 45-day period, we can't reconsider a policy during that 45-day period. Once it becomes active, then you can do a reconsideration request. And just like with everything else, if you're in the policy section of our website, and I'm just going to jump back here 1 second, we're going to go to the topic center and again to policies. Looking up at the top, you can see right here in the top, there's a quick link to the NCD and LCD reconsideration process. Now it is in the bottom area. That's where it's actually stored. I just used the quick link though. I'm not going to research or try to look further. By doing that, it'll explain the different processes you need to know. So we're going to go through this information, the purpose of the reconsideration, the components of the reconsideration, just all of this. But I want to remind you that even on this page, we tell you that you may need to do a claim appeal, because a claim appeal is not a policy reconsideration. They are different. And just because you have a policy reconsidered, the claim can still stand denied without having anyone look at it. And you only have 120 days, so you don't want to miss that opportunity, right? The policy reconsideration may take a lot longer by the time they get through all the steps. So we want to make sure we're following all these different pieces of information, okay? All right. So let's jump back to the PowerPoint and I'll walk you through what that says, hopefully in a little bit of a speedier manner than trying to read through all of that information. So first, a policy reconsideration must be from an interested party. The same people that could request a new one can request a reconsideration. We have had reconsiderations received from someone who doesn't have anything to do with our jurisdiction. We cannot look at that. Nothing to do with our jurisdiction. When the interested party puts this together, the first thing is start with specific languages to add, delete, change, do whatever you're going to do to it. Tell us what you want and be specific. You do need to include, again, the benefit category. And this is the statutorily defined benefit category. One thing that is common is that we get the policy reconsideration request because of new medical evidence, new studies, new things that have happened, or even consider this policy because now there's a brand new technology, right? So we got to have all the medical literature. But again, should you include a link? I hope you got no. Remember, PDFs, good. Links, bad. All right, so then just again, tell us the information, tell us why it's useful, clinical, health outcomes, all of that, and fully explain the design, purpose, method, of using this item or service. What we're really trying to do is figure out what's changing that makes the policy as it is today need to be looked at again. Okay, CMS does specify this information. And so one of the key pieces that's missing the most part is this bottom or items. One or the other needs to be there. And this is from CMS. Now, there's always some recommended things that we tell you. The relevant peer-reviewed medical literature attached as a copy. Um, this is some of the stuff that's interesting because if there's new literature and you want us to look at it or you're trying to justify with it, you have to incorporate it. If not, we can't just take someone's word that it's out there. We really need to know what it is. If there is certain things that happen or is better for certain types of people, certain health disparities, all those different things, incorporate any of that. And then whether or not you are going to request information that could also help with that health disparities. The next step, we get a written request in. It comes into our policy staff. This does not come through customer service and should come to policycomments@wpsic.com or the fax or the written address that we sent before. Remember, those are your options. Which one is recommended? Always the email. Once we get it in, our nurses and medical directors, which are doctors, they have to sit down and go through it. They're not looking to decide, yes, we're going to do a reconsideration. Yes, we're going to rewrite a policy. That's not what they're doing at this point. They're sitting down to make sure that the request you sent in is valid and has everything it needs. They will let you know within 60 days. Yep, it's good. That does not ensure that we're going to rewrite the policy. We are not necessarily going to do a reconsideration. However, that is to tell you that we do have a valid request. Okay. Now it gets added to the LCD review list once we get a valid request. And, we'll add it into the draft process and all the different steps that go with that. The thing with the response that you're getting back is to simply tell you, hey, we have to do more research. What types of research could we do? Well, first, claims research. Anyone that's ever done claims analysis research knows it takes time. Do we have enough to justify doing this? Is the current policy working? Is the information you're submitting going to affect the current rejections, denials, whatever the policy is doing? If none of that's going to occur, then we may choose not to do a reconsideration. If it will occur, then how much is the dollar amount? What is the high dollar, high volume edits? Are we looking at enough to make it work that way? So there's just a lot that goes on before we do the reconsideration. Should the reconsideration be decided upon, what it will do is create a new draft policy. So when we talked about the new draft policy, the comments that you can give there, it is again going to be put back through that full draft process. So keep in mind, you should contact our policy department with the following. 1, a new policy request, and you want them to write a policy, or you want them to consider a policy and make sure you have everything together so that they can write a policy. 2, once a policy is written and released as draft, this is the key moment. This is when you can make the most impact. Look, get that information and get that peer review and get that information together so they can consider it. The last one is, okay, it's good. Something changed. I needed to reconsider. And at this point, yes, we will reconsider it. But again, the data analysis and a variety of other things will factor into this. All of the methods of getting a hold of policy are the same. So that's one of the key things we wanted to do. I did want to finish this session up with some question and answers. So I do want to encourage you, again, if you have questions, throw them in the chat. Mary, she's going to ask them out in just a little bit, but she needs to compile them. In the meantime, we did have some questions submitted that I thought were pretty good and really relevant to this information, something you might want to hear about. So I put these together. This is questions, again, pre-submitted questions that came in as part of the registration process. Okay. What if you notice that WPS is missing a procedure or diagnosis code? You will email the policy staff. That's not necessarily a customer service response, but email the policy staff. They can look at the article without doing a full-on request, and they can add information. Same thing with a typo or something that is transposed. they can easily look at that. Those can be corrected without going through a full reconsideration. You're not looking at a medical necessity piece of information. You're looking at something fairly minimal. But if you don't let us know, it could affect other things such as edits and audits. We were asked a couple of different times about contacting customer service. And I think that the confusion comes in again is you hear policy, you hear local coverage determination or national coverage determination, you think policy, yep, I should go to them. The correct answer is, what are you trying to get done? Are you trying to work with a claim? Then you need to do one of two things: contact customer service for an explanation, or contact appeals, start with a redetermination and see if you can get it medically reconsidered. Now, again, if you're doing the redetermination, you can still do a reconsideration request if you feel like a policy does need to be rewritten. It's not a one or the other. Sometimes it's actually both, which means you're going to have to put the work in and you have to decide whether that's worth it. One person asked if they should contact WPS regarding NCDs, and the answer to this is kind of a twofold answer, just like it is with LCDs. If you're talking about the development of an NCD or a national coverage determination, then no. If you're talking about data they use, if you're talking about requesting a new one, that's all done through CMS, right? That's why it's a national coverage determination. On the other hand, if you're saying, yeah, it's fine, I just don't really understand why it's denying this way, and this claim doesn't seem to be denying properly, now that's WPS. That's our customer service department. It's not going to be our policy department. Remember, our policy department works with local coverage determinations and local coverage articles. Now, let's say that you're reading an article related to an NCD, and you find a typo or you find something within it and you're like, this isn't like really working out. Then you could possibly go back to our policy department, notify them, and they can look into it further. So we don't want to make it seem like you couldn't regarding an NCD. It just really depends on the question and the information you find. Do articles go through the same process as local coverage determinations? And the answer is no. The local coverage article doesn't have quite as much of a process to go through, because what we're really writing on is the edits and audits within the system. So it doesn't have to go through the draft and the comment periods and the things like that. It's the policy, the medical necessity portion that does, and then we can write edits and audits based on that. So it doesn't necessarily mean that the article will go through the same process. Now, let me also explain that if we're writing a draft or reconsideration or whatever we're doing with it, yes, we could put it through that process. Okay, yes, we could. So there's a variety of different things that can be affected. And when we put the LCD through the draft process, the LCA may be contained as part of that. Okay, we want you to review both. Okay, so I'm going to stop here for a second, but I do need to jump to the website because the next few questions are not on the slides because they are website related. So a couple of things came up and I want to remind everyone. First, someone asked if there are forms to fill out for this. And the answer is no, there are not forms to fill out. You won't go to tools, you won't go to all tools and go to forms list and find a nice list that says LCD reconsideration. On the other hand, you will want to follow all of the instructions in the policy area, and you do want to make sure you're following the proper thing. Are you requesting a new? Are you requesting a reconsideration? What are you doing? Because each one will have certain pieces of information. If you don't want to follow this navigation, you can go by specialty or you can go A to Z. I like the A to Z list. It's just me. It's 26 items, but it gives me the opportunity to read all of the different titles. It's just a preference I have. Okay. How can you find an LCD that affects my claim? We went through the Medicare coverage database, but I want to remind everyone that we have a quick link to and a tool. The tools is under tool. We'll look at that in a second. But there's a quick link right on the front of our, and it's called a code lookup, that you can actually look up LCDs by search, by procedure code, whatever you want to do there. Same thing with NCDs. Now this tool, the full tool, is housed within our tools section. And if you go to the very second item, you'll see LCD article lookup. Now, why is this the full tool versus a quick link? Well, on the front, did you see all of the different LCDs listed? If you didn't, that's an indication that you're just using a quick tool. Okay. Now on here, if I wanted to say I want a procedure code, or I want this, or I want that, I can look that up. I can, again, do allergy, and it's going to automatically say WPS. Here's your allergy testing policy. Here's your coding and billing articles that you have. Which one are you looking for? But did you notice something else? See this? This was another question we were asked. How do I find the CPTs and HCPCS that affected? When you use our tool and you use the billing article results, it's going to give you this information. Now, the person that asked me didn't have a specific procedure code, so I don't have something that they were specifically looking for. So I'm not really sure what to go with that. Then you want to check out and just check out your status codes. And why is this important? Retired, active. This one's old, this one's not. Hopefully that makes sense. Just retired and active. But it'll kind of walk you through all the different things you want to know. Someone said, hey, what about foot? I'm using that for foot care. Well, we didn't find an article. I'm sorry, we didn't find, let's rephrase that. We didn't find a policy, a local coverage determination, but there is an article. Why? Well, the article comes from the Medicare internet only manuals and the benefit coverage manual. So this is how we put edits in place to meet that requirement. That's what an article is. So hopefully that explains a little bit about why you might want to look up the code lookup tool. Again, if you're looking for certain procedure code, it's a great way to do that. One of the other questions we were asked is, how do you know which LCD to use? And the basic answer is you're kind of going to use this code lookup, and you're going to start searching around with what you think are keywords. One of the things that, we always go back and forth with is, what did Medicare call that today? If you've never experienced that, you're probably newer to Medicare. What keyword were they using for that? Were they using podiatry versus foot care? Were they using nail debridement? What was the word we were looking for versus foot care? And so there's a variety of different things you want to do. I always recommend that the best way to start is to come into this code lookup tool, dig your way through it, guess some different terminologies. Now, on the other hand, if there's a clearly defined benefit category for it, that would be the starting point. So it really just depends on what you're looking for. It's not as easy as like one item. Search features are always great. Some people do like the benefits and eligibility section. They can come in and they can take a look at some of the summaries on the different benefits and eligibility. And then inside there, it'll relate to certain things, so it could relate to a policy. Another area to help you is the training center. Scroll down, stay on the right side, go to the specialty and services area. If you pick one of these and we do happen to have a policy on it, whether that is a national policy for Medicare or a local policy, it should list it. Let me see if we can find one that has one. But as you go through, you'll find different things. So here's chiropractic, and then it talks about all the different things, job aids. Okay, this one has an article, but not a policy. But you will also be able to list very quickly to that article. So it's great to get through those different pieces of information. Now, if you heard me talk about the internet only manual, the Medicare benefit policy manual, claims processing, all of that, that's what this is down here. And that's what this article actually relates to. This up here relates to this. So just a lot of good information back and forth. We've been through this, but I want to make sure that I'm giving you the options again. Current LCDs as related to multiple contractors. How do you find those? And they will be listed under every contractor. For those of you that don't understand what I'm talking about, different MACs, which is your Medicare administrative contractors from different jurisdictions, can join together and write one LCD. That local coverage determination will be for more than that contractor's jurisdictions. It's called a multi-jurisdictional LCD. And these are great ways when there's a national issue or part of a national issue, or certain areas are facing it, but not the entire nation, to get these contractors to give the same coverage to everyone within that jurisdiction, but also multiple jurisdictions. And we can partner with any of the other MACs to do that. It really just depends on what the data is showing at that time. I'm going to stop for a second and just see if Mary Sue has any questions, because that was my last pre-submitted question.
Hi, Tom. There are no additional questions in the chat.
All right, let's jump back to the PowerPoint. So we're going to ask again, take the survey. How do you do that? Well, use the link that Mary Sue's going to put in the chat. That's one great way. Two, we're going to give you a little pop-up box. It looks like the one on the right here. It says external site. This isn't spam. This isn't malware. This is WPS taking you to the CMS survey. You notice it says CMS MAC Fed Ramp. That's the key to the address. It's Qualtrics. They're the company that does this for us. CMS uses this survey, so do we. Okay. So lots of good information in there. Also, if you're doing this or you're watching this in the Encore presentation, look for the online survey picture or the information in the upper right corner. It's a little information button. That will take you to the survey. Now, what kind of things should you include on the survey? Hey, anything you want. I was called my good, bad, and ugly. What did I do well? What didn't I do well? What do you think I could improve on? And my ugly is, did you like my PowerPoint presentation? Were there things that would have made it more effective for you? Is there another visual cue I could have used? I know there was a section where I went to the website. Did I get you the right websites? Were you able to see and navigate through based on that? My good, my bad, and my ugly. All right. What else should you know? Well, you should know that in a few minutes, you're going to get an email from us. This email does contain your certificate. Your certificate gives you contact hours. Contact hours can lead to CEUs. We don't issue CEUs, but we do give you contact hours. So you want to make sure you keep it, you open it, you read it. The email also contains a fun link to the survey. So take that survey. Lots of stuff going on there. If you do think of any additional questions, please feel free to email them to us. It's WPS.GHA.education@WPSIC.com. Put WPS policies, something like that, in the subject line. What we will do is next Tuesday, we have another event. And in that event, we will build all of those questions in and answer any of those questions for you. So if you think of things, if things come up, feel free to do that. All right. So thanks for listening. We really appreciate your feedback. We really would love information. I want to throw it out to my team. If anyone has anything else they'd like to talk about real quick, we do have a couple of minutes. If not, we'll move on. But anybody? All right, not hearing anything. That means we're going to move on. On behalf of myself, Mary Sue, and all the Provider Ocean Education, thanks for participating. We look forward to your survey comments, and we hope that you'll join us again in the future. You may now disconnect.